Okay, this is chapter 22, substance-related and addictive disorders. As we begin this chapter, it is important to understand that substance use disorders are not an illness of choice, but rather a disease characterized by craving, seeking, and using these substances regardless of the potential consequences. Continued use of substances actually changes the brain structure. Now, two agencies are dedicated to research and they aid in substance use disorders, and these are the National Institute on Drug Abuse and the Substance Abuse and Mental Health Administration. So, a substance use disorder is a pathological use of a substance that leads to a disorder of the use and includes things that can be swallowed, inhaled, or injected, which can range from mild to highly addictive. Examples can include alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedative hypnotics, stimulants, as well as tobacco products. Gambling, shopping, and sex are considered process addictions, which are not physical substances, but a behavior that stimulates the same pleasure pathway in the brain as substances do. Now, there are several concepts that are central to addictive use disorders. The first one is addiction. Addiction is a chronic brain disease that can be treated and managed with medication, therapy, or both. Addictions can seriously interfere with a person's daily life and typically worsen over time. Addictions can lead to permanent health complications and serious consequences, including death. Intoxication is using a substance to excess, which affects the individual's mood as well as physical and mental abilities. Tolerance are developed when it takes a higher dose to achieve the initial level of response. Tolerance can be rapid or occur after several weeks or months of consistent use. Withdrawal are symptoms that occur when an individual stops using a substance and varies depending on which substance has been used. Now, withdrawal may result in the individual using the substance again in order to avoid the withdrawal symptoms. And scheduled drugs. This is a classification system of drugs, with Schedule 1 being the most addictive and Schedule 5 being the least addictive. Table 22.1 on pages 408 to 409 lists examples of commonly misused drugs and substances. Now, scheduled drugs, you may actually see these being diverted in healthcare. So you should, if you see a diversion happening, so this is, say, a nurse or a physician who is stealing a substance. If it's a nurse, you need to take the nurse away from the patient care. Get them out of the patient realm. You will, of course, let the nurse manager know. You need to offer a non-punitive peer assistance, because this will also manage their testing, but then they will know that they're getting the help that they need, and you will have to report them to state boards. Typically, this is going to all be handled by nursing administration, and your job as a nurse on the floor will simply be to report it to the person you report to. So the epidemiology of substance use disorders, about 60% of people surveyed use some form of a substance, whether it's alcohol, tobacco, caffeine, or illicit drugs, and they did this within 1 month prior of the survey. An actual disorder is different from recreational use, though. Approximately 15 million people are addicted to alcohol, 8 million to other substances, 4.5 million to marijuana, and 2 million to opioids. Now, comorbidities. An individual can have a co-occurring mental illness, or they can have polydrug use. Comorbidities can include heart disease, stroke, dental issues, hepatitis, as well as cirrhosis. And risk factors. Genetically, there are familial tendencies, especially for cannabis, cocaine, and opiates. Neurobiological factors. The main neurotransmitters involved in substance use disorder are opioids, catecholamine, and GABA. And environmental factors can include poverty due to impaired support systems and lack of parental supervision, living in a disadvantaged neighborhood, and poor educational resources. So caffeine is the most widely used psychoactive substance in the world. Caffeine use is not an actual disorder for excessive use, but it can result in intoxication, overdose, and withdrawal. A cup of regular coffee has about 95 milligrams of caffeine, whereas an energy drink has about 300 to 400 milligrams of caffeine. Caffeine intoxication occurs when a person consumes well above 200 milligrams and they begin to feel nervous, restless, excited, twitchy, and flushed. These symptoms can affect work, school, or your social life. Now, overdose is rare with a cup of coffee or tea, but it can occur with the use of energy drinks or diet supplements, especially in adolescents, with the lethal dose being between 80 to 100 milligrams. Symptoms of caffeine overdose include tachycardia, fever, hypertension, which then leads to hypotension. Also, they may have seizures, respiratory failure, and death. Treatment will consist of fluids, gastric lavage, beta blockade for tachycardia, and vasopressors for blood pressure. Now, cannabis is the third most commonly used psychoactive drug in the U.S. Intoxication can occur and results in at least two of the following: conjunctival infection, which is red eyes, increased appetite, dry mouth, and tachycardia. Hallucinations, depersonalization, and derealization may also occur. Withdrawal symptoms begin within 1 week of stopping use and include feelings of anger, irritability, and/or aggression, sensations of extreme nervousness and anxiety, disturbances in sleep, decreased appetite, abdominal pain, chills, sweating, headache, and tremors. Treatment involves abstinence and support, as well as individual, group, and family therapy. Hallucinogens can cause profound disturbances in reality. Examples could be LSD and PCP. Now, hallucinogens use is a disorder that is diagnosed after a 12-month period of use that includes symptoms such as cravings, difficulty with role obligations, impairment, and intolerance. Now, intoxication occurs when a person experiences significant behavioral and psychological changes, such as paranoia, illusions, hallucinations, synesthesia, which is hearing colors or seeing sounds, as well as physical symptoms such as tachycardia, sweating, pupil dilation, and tremors. Now, treatment includes assurance that the symptoms are temporary and the patient may require restraint. Haldol or Valium may be used temporarily until the symptoms subside. Now, PCP intoxication is a serious medical emergency as the patient can experience violent and dangerous side effects. Withdrawal symptoms can occur, which are similar to the symptoms experienced while intoxicated and can impair normal functioning for weeks, months, or even years. Inhalants are substances that are inhaled through the nose or the mouth, with commonly used substances being solvents for things like glue, adhesives, propellants, thinners, and fuels. Now, these are commonly used in adolescents, and many often do not realize that inhaling the fumes of these products, even once, can be very harmful to the brain and the body, and it can lead to death. Intoxication results in fearfulness, illusions, hallucinations, impaired judgment and functioning, aggressive behavior, psychosis, and unconsciousness. Now, opioid use disorder. Opioids use refers to heroin and prescription drugs like fentanyl and OxyContin. Usually, people begin using this between the ages of 18 to 25 years. But let's talk for a moment about opioid intoxication. Now, tolerance develops and results in significant impairment in life roles, interpersonal conflict, and it puts the person in physically hazardous situations. You can see your symptoms here on page 413 of your text. But one of the things about the cravings and this intoxication and this tolerance, as they build a tolerance, they're going to use higher and higher doses because they're chasing feelings of euphoria. Now, overdose can result in death, and it's usually going to be caused by respiratory arrest. Indicative symptoms include coma, pinpoint pupils, and respiratory depression. Now, there is a treatment for overdose, and that is naloxone, also known as Narcan. And naloxone can be administered IV, IM, sub-Q, or even intranasally, and now is even available over the counter. Now, opioid withdrawals. You're going to withdraw from things like morphine, methadone, and heroin, and withdrawals from those begin around 6 to 8 hours after last use, and the withdrawal symptoms can last about a week. Now, Demerol withdrawal begins around 8 to 12 hours after last use and lasts about 5 days. Now, box 22.1 on page 414 is a very important box that you should be familiar with. This gives you opioid intoxication and opioid withdrawal symptoms. Now, methadone is a common medication used for opioid withdrawal, so you can become addicted to it, but it also can be a treatment. And it's administered once daily by an opioid treatment center. Clonidine and lofexidine are both alpha agonists. Think back to your pharm class. But these can also be used for opioid withdrawal. However, lofexidine is expensive, and it costs about $1,700 a week compared to $1 a week for clonidine. Buprenorphine can cause similar effects of opioids, but they're mild, and it aids with withdrawal. Now, it's only used after about 12 to 24 hours with no opioid use and after the patient is stabilized, and then you're going to change them to another medication. Opioid maintenance. Pharmacologically, naltrexone again is a daily naltrexone is a daily medication that's used to prevent opioid intoxication. Vivitrol is a long-acting injectable form of naltrexone that is administered once a month, and it's helpful for patients that have difficulty with adherence to that daily regimen. And then you have your psychotherapies, such as individual therapy, behavioral therapy, cognitive behavioral therapy, family therapy, and social skills training. And these can be useful because it offers you structured support programs. Other programs such as Narcotics Anonymous are also useful. Your sedative, hypnotic, and anti-anxiety medication use disorder, these are problematic substances. And some of the main substances that are problematic are going to be your benzodiazepines and drugs similar to them, as well as carbamates, barbiturates, and other like drugs. Now, if a patient overdoses on these, they're going to need gastric lavage, and we're going to have to carefully monitor them, especially with these benzos, because of the respiratory depression it can cause. Now, withdrawal occurs if you suddenly stop these substances, so a gradual reduction in dose is crucial to prevent seizures in these patients. Now, clinically, the clinical picture, stimulants are amphetamine-type drugs, cocaine and ecstasy. They are the most widely used illicit drug after cannabis, and the disorder can occur within 1 week of consistent use. Patients may experience psychological symptoms as well as physical symptoms, and on page 416, you can see these symptoms in this box. Now, withdrawal treatment. Symptoms usually begin of going through withdrawals within hours or even days after the last use. Depression and suicidal ideation are the most serious possible consequences of withdrawal. Again, refer to box 22.2. Group and individual therapy may be used to help these people, but they may require treatment for depression even once withdrawal has completed. Now, if your patient overdoses on a stimulant, it is going to be important to monitor their vital signs because an overdose on stimulants can cause respiratory and circulatory dysfunction as well as hyperthermia. So some others. Tobacco dependence occurs quickly with cigarettes, which are the most commonly used form. Vaping has also become very popular, especially among your adolescents. Now, tobacco withdrawal can be difficult and distressing, with the patient experiencing irritability, anxiety, depression, difficulty concentrating, restlessness, insomnia, increased heart rate, as well as weight gain. Withdrawal symptoms from tobacco can be treated with behavioral therapy, hypnosis, or nicotine replacement therapies. Some medications, bupropion and varenicline, have both been approved by the FDA to help reduce cravings. Gambling disorder. Gambling is an addictive and compulsive behavior that results in relationship and work impairment. These people may also display depression and or anxiety related to the gambling and the debt. Gamblers Anonymous is a 12-step program out there that's similar to Alcohol and Narcotics Anonymous. And other treatment options may be SSRIs, bupropion, mood stabilizers, as well as anticonvulsants. Alcohol. Alcohol use disorder. Individuals experience a sedative effect with initial euphoria. The severity is based on the number of symptoms the individual has, with mild being only 2 to 3 symptoms, moderate is 4 to 5 symptoms, and severe is more than 5. You can see your DSM criteria box on pages 417 to 418. Now, alcohol use disorder is almost twice the prevalence among adult men than there is among women. But alcohol use affects about 3.4 million young adults from the ages of 18 to 25 and 11 million adults 26 and older. Now, comorbidities can occur, such as with bipolar disorder, schizophrenia, antisocial personality disorder, and major depressive disorder. Risk factors genetically, there is between a 40 to 60% genetic component here. Neurobiological, there are differences in their brain activity and brain structure. Social, peer pressure in adolescence plays a huge role in this, but that can even be in adulthood. And cultural, some cultures believe that alcohol is not acceptable at all, and in others it's just a part of everyday life. But there are types of problematic drinking. You can see table 22.2 on page 419, or 22.3, excuse me, on page 419 for acceptable and safe drinks. But let's talk about binge drinking. This is when you consume too much alcohol in a very short period of time. Women, this would be considered 4 or more drinks within 2 hours, and for men, 5 or more drinks within 2 hours. And then heavy drinking is consuming too much alcohol too often. For women, this is 8 or more drinks in a week, and for men, it is 14 or more drinks in a week. Now, the legal limit in Georgia for alcohol is 0.08 grams per deciliter. And alcohol intoxication is based on how many alcoholic drinks are consumed in a certain amount of time and how much alcohol content the drinks have. On page 419, figure 22.2 gives you some examples. Now, alcohol withdrawal symptoms begin within 6 to 8 hours after cessation of alcohol, with the classic sign being tremors. Now, Librium may be administered to help with these mild to moderate symptoms. So at 8 to 12 hours, the patient begins to experience psychotic symptoms, which is a medical emergency. The patient may experience seizures, delirium, and unconsciousness. Librium or Ativan can be given IM or PO and then tapered over the next 5 to 7 days. At 12 to 24 hours, the patient may begin to experience seizures, and Valium can be given IM to help control seizure activity. Within the first 72 hours, alcohol withdrawal delirium, which is known as delirium tremens or DTs, can occur, which is a serious medical emergency. Death occurs in about 20% of patients that experience DTs. The patient may experience hallucinations and delusions and become a danger to themselves or others, and sedation may be necessary. Now, can have cognitive disturbances. The first one is called Wernicke-Korsakoff syndrome, and these are distinct but overlapping disorders that occur due to a deficiency in vitamin B1, which can cause confusion, ataxia, which is that inability to coordinate voluntary movement, and eye abnormalities in the acute phase. And if these are left untreated, they become irreversible and can cause memory impairment. Now, if caught early enough, you can treat with large doses of thiamine by IV infusion 2 to 3 times a day for 1 to 2 weeks. And then blackouts occur when the individual consumes excessive amounts of alcohol and then experiences amnesia. They may appear to function normally, but later they have no recollection of what happened. And finally, fetal alcohol syndrome is a lifelong condition that develops in a fetus when a woman drinks alcohol during pregnancy. It causes malformations such as microcephaly, craniofacial structures, limb and heart defects, as well as intellectual disabilities. And you can see figure 22.3 on page 420 in your textbook. Now, alcohol can cause systemic effects. The first one is peripheral neuropathy. This is the feelings of pins and needles in your lower extremities, as well as numbness and weakness due to a lack of thiamine or vitamin B1. Alcoholic myopathy or cardiomyopathy. So myopathy is reduced muscle mass, which leads to muscle weakness. Cardiomyopathy is weakening and thinning of heart muscle, which leads to enlargement and heart failure. Esophagitis, gastritis, and pancreatitis. Now, inflammation of esophagus and esophageal varices can occur. Toxins of alcohol can erode the lining of the stomach, causing gastritis. Pancreatitis occurs with excessive alcohol intake for at least 5 years and can lead to malnutrition, weight loss, and diabetes. Alcoholic hepatitis is caused from heavy drinking. Cirrhosis of the liver. Late-stage liver disease in which healthy liver tissue is replaced with scar tissue and it permanently damages the liver. Leukopenia or low white blood cells, which makes a person susceptible to infection. Thrombocytopenia or low platelets caused by buildup of platelets in the enlarged spleen. And the cancer is due to increased hormone levels. Now, screening tools, the SBIRT is screening, brief intervention, and referral to treatment. It's usually performed at primary care centers, EDs, trauma centers, and other community centers. The screening part quickly assesses the severity of substance use and identifies appropriate level of treatment. The brief intervention focuses on increasing insight and awareness regarding substance use and motivation toward behavioral change. And referral to treatment provides more extensive treatment with access to specialty care. The next one is audit, Alcohol Use Disorders Identification Test. It is a 10-item tool developed with the WHO to assess the World Health Organization to assess alcohol consumption, drinking behaviors, and alcohol-related problems. Now, there are 2 types included, a self-report version and a clinical administrative version. A score of 8 or more is considered hazardous or harmful alcohol use. Table 22.4 on page 422 is an example of the self-report version. The CAGE screening is a 4-question screening tool using the acronym CAGE, where C equals cutting down, A, annoyance by criticism, G, guilty feeling, and E, eye openers. And you can find these questions also on page 422. Right here. And then CAGE AID uses the same questions as regular CAGE, but it also adds drug use. And the TACE is tolerance, annoyance, cut down, and eye opener. Now, our nursing process, of course, begins with assessment. A comprehensive Comprehensive assessment includes alcohol assessment, usually performed by an addiction specialist, but you also need to do a family and a self-assessment. Now, the family assessment includes those living with a person struggling with alcohol addiction, and they can be affected in multiple ways. Codependence can occur, which is when a person's addiction is reliant on action and behaviors of another person. And then self-assessment is important because alcohol is self-inflicted. It is important for the nurse to assess feelings and be aware of biases and judgments. Nurses can also fall into addictions of alcohol and other substances, and you need to do a self-assessment with all substance abuse. Now, the nursing diagnosis, the priority is based on the screening tool and the comprehensive outcome, or comprehensive assessment. Your outcomes identifications are in Table 22.5 on page 423, but the priority outcome may be the patient recognizing that this is going to be a lifetime battle and that they may need long-term treatment. In planning, it is important to identify the problem, set a goal, and determine steps to achieve that goal. Implementation, you can see here on the slide, promoting safety and sleep are going to be your first line interventions. Reintroducing good nutrition and hydration, support for self-care, and exploring harmful thoughts and spiritual distress. And then you have your health teaching and health promotion. We want a prevention against genetic vulnerability, and they may need public classes to help them with everything. Evaluation. For success, you need to help the patient assess their needed life skills and provide appropriate referrals. Practice anticipatory problem solving and role play even to help the patient predetermine how they're going to deal with stressful situations. And teach about physiological changes that they may have in their bodies and how they're going to cope with those. Now, drugs, there are treatment modalities. You're going to want to refer to Table 22.6 on page 425 of your book. But there are drugs such as disulfiram, naltrexone, and benzodiazepines. Now, disulfiram specifically produces a sensitivity to alcohol, and it causes them, if they ingest any type of alcohol, to have severe nausea and vomiting. So it's like an aversion therapy. But you also need to educate patients on disulfiram to avoid hidden sources of alcohol, say in cough syrup, in alcohol skin products, cologne, strong alcohol foods, or even foods that were prepared with alcohol, because they could have that nausea and vomiting. Psychotherapy, cognitive behavioral therapy works best, but then there's motivational interviewing. And this is a therapeutic technique based on the trans-theoretical change theory that's used to address addiction and substance use disorders in patients by strengthening their motivation and their commitment to a particular goal, such as sobriety. The core goals of motivational interviewing are to express empathy and elicit clients' reasons for and commitment to changing substance use and other unhealthy behaviors. And then there's the trans-theoretical stages of change theory. These stages include pre-contemplation, contemplation, preparation, action, and maintenance. And you can find these on page 424 in your book. I was trying to put eyes on them. Our care continuum. Necessary care is continuous and may include detox, rehab, halfway houses, partial hospitalization programs, intensive outpatient programs, outpatient treatment, Alcoholics Anonymous, and relapse prevention. Now, as far as detox, you need to understand that the patient may have increased blood pressure and heart rate, which may be a sign of impending alcohol withdrawal and the need for detox and medical intervention prior to a hypertensive crisis and or seizures. A nurse is assessing a client who has alcohol use disorder and is experiencing withdrawal. Which of the following findings should the nurse expect? Select all that apply. B, D, E. fine tremors of both hands, vomiting, and restlessness. Um, they're not going to have bradycardia, they're going to have tachycardia, and they're going to be hypertensive, not hypotensive, if they are going through withdrawals.